What's up, everyone? If you want to get double chin lipo and you don't know everything about all the technology out there, watch this video to learn a little bit more. Welcome to this week's Sauger Says, where I'm going to be explaining the differences between smart lipo, laser lipo, HD lipo, J plasma, and all the different types of fancy schmancy lipos out there. And I'm going to be comparing them and telling you about how that's different than plain old regular double chin lipo. So before we get started, just as a disclaimer, I don't own any of those fancy devices. I just do regular plain old lipo. I use a specific technique called dry lipo in some patients to enhance my results, but for the most part, we do not do anything different than the lipo that's been around for decades. When it comes down to it, our neck has different layers that are really important for liposuction. The key differences between why some surgeons get great before and afters and the other one is going to be patient selection. And understanding your candidacy is of critical importance. The way I like to describe the neck is like a teepee. So if you're talking about the base and the foundation, that is going to be the one thing that we cannot get great results without it, and that is going to be your mandible or your jawbone. The stronger that structure, the more it sticks out to begin with, the better results I can get you. Remember, we can't lipo above the jawbone because you have a nerve that runs right on the edge of it that controls your smile, and we want to stay away from that. Now, the second structure that's the very top of the teepee is going to be your hyoid bone. It is a bone that sits right at the top of your windpipe. Once again, we can't move your windpipe, we can't adjust this bone, but having a hyoid that on profile view is high and posterior is going to give you the best results. It's often difficult to feel for it in a fuller neck, but as a surgeon, that's what I'm evaluating because that's how I can determine what is going to be my endpoint for getting you the best results. Some people like myself, who I would call skinny fat, have a good jawline and a good neck simply because my hyoid is set way far back. Some people who weigh a little bit less, when they say their double chin is genetic, it's because that hyoid is forward and it squishes everything together. A bad hyoid in combination with a weak jawbone is going to be one of those necks that goes straight from your chin down into your neck. And no amount of liposuction or fancy equipment is going to help improve your results. Now, the second most important characteristics is the outside of that tent. That's going to be your skin. Skin changes with age. That is probably going to be the number one factor. As you get closer to 40, your skin loses that inherent elasticity. That elasticity, for example, if you take an 85-year-old patient and you squeeze their skin on their hand and let go, it will stay tented. That is poor elasticity. Once I remove the fat, I want to know that your skin is going to shrink wrap right back to where it needs to be, and that's something that your skin is going to change. There's things we can do that help that, and I will go through that when we talk about the different technologies and my dry lipo technique. Last but not least is the fat. The fat's separated in two layers, an outside layer that's attached to the skin and an inside layer. Between these layers is a muscle called the platysma. When we do that, that's the platysma muscle. All the fat deep to that is not taken out with standard liposuction. In order to remove that, we need to make a larger incision and go digging for it. For most patients, that's not generally recommended, but that residual fullness you have after liposuctions many times can be that deep fat that we weren't targeting anyways. So you really need to have a good understanding from your surgeon as to what your goals are, and if it truly is that deep fat, then you need a different type of a surgery altogether. Now, as we go through the teepee, we want to narrow it by having a wider base, a tall, high hyoid, and getting that as much of that fat on the outside so the skin shrinks in. Now, as we go through the different technologies, we have smart lipo, laser lipo, HD lipo, whatever, J plasma. All of these tools are simply energy that's placed for two reasons. And you really need to understand the reason behind those two reasons, okay? So the first is going to be to make the fat easier to come out. For the vast majority of patients, you are paying for your surgeon to be able to work faster and easier. When you look at that surgeon's results, they're going to be no better than anyone else's. It's simply going to cost you more for the surgeon to be able to do more cases every day. In reality, that cost should not be passed on to the consumer. But it's a truth. When you spend $200,000 on a fancy machine, someone's going to have to pay for it. Now, if it's only making the surgeon's life easier, I don't think it's fair that you have to pay for it. Now, the second energy advantage is going to be heating of the underlying tissues. Theoretically, this causes some skin tightening. Now, not everybody needs skin tightening. We're talking about the 35, 36-year-olds who has slightly lax skin that we aren't sure if the skin is going to tighten up as much as we want, and doing a procedure such as J-plasma or smart lipo might be of benefit. Unfortunately, we see a lot of people that once you have a hammer, everything looks like a nail. Just because you have a J-plasma machine does not mean that everybody needs that. You really have to be concerned about skin laxity. If you're 21 and getting J-plasma or a smart lipo, you're paying extra money. I don't care to who, you're paying it for not your results, but to make your surgeon's life easier. You have to understand that these technologies that are changing every year cost a lot of money, have to be paid for somehow, and not everybody needs them. I use traditional lipo. Sometimes I have patients where the fat is very difficult to come out. For example, patients who've previously had liposuction or Kybella, which makes up 20% of my practice. What do I do differently? I use elbow grease. Sometimes in larger patients with more volume, I'll use something called a microwear, which is a cannula that vibrates at the same time that helps break up the fat. But other than that, I'm using elbow grease and thyme. I'm exhausted after liposuction, as I should be, because I'm putting in the work. And all I challenge you to do is find before and afters of surgeons who use those fancy machines and tell me if they're definitively better, every single one of them, than mine. The answer to that is going to be no. Why? Because those machines don't make enough of a difference to justify the cost. They are marketing gimmicks for the most part that should be used only in a select few patients where laxity is an issue. Now, if you have any further questions, of course, every individual is going to have differences in evaluating their skin, underlying architecture, and anatomy, and that's where a consultation is critical. It's important to go to a board-certified surgeon like myself who understands these differences, as going to a lipo center where everyone's just getting in and out. That's how you're going to not get the results, because patient selection is the most important thing. If you have any questions, feel free to reach out to our office, call to schedule a consultation. Please like and subscribe to the channel. Look forward to meeting you in person.